is Marcus Brioschi. I'm a chairman of American Academy of Thermology, also fellow in clinical research by Harvard Medical School. Actually, I'm a general surgeon and a trauma surgeon. Today, I'm talking about thermography and early identification of Charcot Foot infection. Charcot Foot is a severe condition and complication often associated with diabetes. Is a condition characterized by neuropathy, bone and joint deformities, and an increased risk of infection. Early identification of infections in Charcot Foot is crucial to prevent severe complications, including amputation. Thermography is a non-invasive imaging technique that detects infrared radiation emitted from the body, has shown promise in the early identification of Charcot Foot infection. It can be done the visual and infrared imaging fusions in one evaluation. Understanding Charcot Foot is important because Charcot Foot develops due to the loss of protective sensation in the foot, leading to repeated trauma and subsequent fractures and dislocations. This condition often goes unnoticed until significant damage occurs, making early diagnosis and intervention vital. Thermography provides a visual map of heat distribution on the surface of the skin. In context of Charcot Foot, areas of increased heat can indicate inflammation, infection, or active disease. The following points outline how thermography aids in early detection. So, perfusion variations. Thermography can detect the subtle perfusion difference between the affected and unaffected foot, indicating early signs of inflammation or infection. It's a non-invasive and safe method. Unlike other imaging techniques, thermography is non-invasive, does not involve radiation exposure, and is safe for repeated use. Early detection. By identifying perfusion changes early, thermography allows for prompt intervention, potentially preventing the progression to more severe stage of Charcot Foot. Is establish measurement, establish a baseline perfusion map of both feet. It's possible to do regular monitoring, conduct a regular thermographic scans to monitor perfusion changes over time. Comparison, compare perfusion readings of the affected foot with the unaffected foot to identify significant variations. But through interpretation, increased perfusion and symmetry assessment. Increased perfusion, areas with significant higher perfusion may indicate inflammation or infection, and evaluate the symmetry of perfusion distribution. Asymmetry may sign early pathology. Here is a publication by Takahashi and Nagase, screening of foot inflammation in diabetic patients by non-invasive image modality. So infrared can be used with ultrasound and Doppler and other anatomic image, but it's a functional imaging, very sensitive for perfusion changes. A publication by David Armstrong from the Texas, they showed in 143 patients a delta T asymmetry between the foots of 4.5 degrees when they have Charcot Foot. Is totally different when has only neuropathy, 0 degrees difference, and feet with ulcer is less, is 3.1 Celsius degree, the difference. And the ulceration risk occurs when there's a delta T more than 3.9 within 1 week before this. So thermography is a way to monitor temperature gradient between corresponding areas of the feet, is predictive of injury before other clinical signs appear. The conclusion of David Armstrong was that this data suggests that infrared dermal thermography We provide valuable information to the clinicians to assist in detection, treatment, and prevention of neuropathic lower extremity sequelae, also in Charcot. Other paper from David Armstrong was monitoring healing of acute Charcot's arthropathy with infrared thermometry. So he followed the patients that has Charcot since the acute phase until the healing, and it was possible to document this by infrared. These images are from my group here in Brazil, but it's very similar. But the question is, Charcot, okay, but there is infection on this? So it's possible to answer this question looking for the sign. This is a specific sign, infrared sign, that's the direction of the flux of the perfusion in a specific angiosome. In this case, it as an alert sign. So yes, we have infection, very hot, the identification partner. We identify the extension, but also the direction. So a plantar and lateral in the posterior tibial segment correspondent to a specific angiosome problems. Thermography is a no-contact assessment that do broader evaluation of physiological impact and detects also deep infections. Other important point is the thermal monitoring antibiotic response, the TMIAR. In this paper published in 2013, it was possible to know the outcome measuring the skin and soft tissue infections in only 2 days, in less than 2 days. So if it's an infection, the thermal response is very rapid. Here's another paper from Armstrong with 39 patients, a follow-up of 22 months. And the findings were higher temperature, associated with greater osteopenia, fracture risk, strong correlation with location of arthropathy. It's possible to identify where it starts. Temperature predicted decreased as acute arthropathy resolved. And there's a 92% correspondence of maximum temperature with fracture location and has a high predictive value. Increased temperature gradients predictive of restoration. So delta T more than 2.4 degrees within 1 week. Here are the skin temperature progression of one of the patients. Other study of McCrockery, they use the NTMCA, that's the adaptive thermal monitoring for Charcot arthropathy method. Is a temperature-based removal decision, removal of the mobilization. So the standard protocol is total mobilization, followed by removal, and after a therapeutic choice. So the decrease in temperature occurs during immobilization, and the stabilization of temperature gradients before transitioning to therapeutic choice. So temperature decrease as a monitoring tool for Charcot arthropathy treatment and assumption of therapeutic choice. It was a 22-month follow-up after switching the therapeutic choice. And 8% showed the significant temperature gradient increases before ulceration, correlating with the location of arthropathy. So infrared is an indicator for therapeutic choice based on temperature decreasing as an indicator for resuming the use of therapeutic choice. So monitoring inflammation resolution during Charcot arthropathy treatment is very important. Here's another Japanese paper, screening for osteomyelitis using thermography in patients with diabetic foot. So it's very specific, very sensitive to identify the case of infection with or without ulcers. We have this possibility, and it's possible to find the site of osteomyelitis and with a high sensitive approach. The benefits and limitations are, the benefits is the early intervention. So thermography facilitates early detection and treatment, reducing the risk of severe complications. Is a non-invasive nature, improves patient compliance and acceptance. Thermography is a relatively cost-effective compared to other image modalities. are relative limitations, because it depends. Thermography may be specific enough to differentiate between various cases of increased perfusion, inflammation, or infection. If AI-based, must be a medical device. And the accuracy of thermography interpretation can be operator dependent, so requiring skilled person, if not AI-based. So medical devices are very important here. There are many papers about the AI in diabetes and Charcot. Here's a paper from Netherlands, infrared thermal imaging for automated detection of diabetic foot complications. Here's Charcot identification by AI. So thermography also has educational benefits. It's effective of seeing the problem, easy to the patient understand. The images are easy for the patients. It has educational tools, helps the doctor educate their patients, explain why the infrared examination is being performed, ensure the patient understand the necessity of a specific treatment. It's patient engagement. Patient becomes more proactive with the treatment, not only the doctor doing the healing, contrast with the passivity of clinical exams. Greater adherence to treatment and guidance, and more effective prevention measures. There are many meta-analyses using the skin temperature as a predictive of neuropathic ulceration and other complications in people with diabetes. Here's a systemic review and meta-analysis with good correlation. And actually, some places, as the David Armstrong service, they have treatment-based classification system for assessment and care of diabetic feet, and thermography is done also in acute Charcot joint. So it's something, it's a routine in the evaluation. Conclusion. Thermography permits early identification, is a valuable tool for early detection of Charcot foot infection, detects perfusion variation effectively, monitoring at-risk patients, promising method for regular monitoring, leads to timely interventions, impacted on the patient outcomes, reduce the incidence of severe complications, improve patient care and outcomes, enhances early detection and management, and leads to better patient care and outcomes. Thank you, everybody. Thank you also, Professor Purit, that is here with us, for welcoming me to Boca Raton at your wonderful regenerative medicine clinic this week. And I leave here my invitation to those who are interested in science and better patient care. I invite you to participate in my mentoring and learn how to use thermography in your practice. These wonderful tools in your clinical practice will make a lot of difference. Just scan me here, my website, for more information, and start now. Welcome.